Welcome to the bulletin. My name is Robinson Okenye and Maresha Owiti is on sign language. Now, let's begin with the health matters. And the Social Health Authority, SHA, has once again come under scrutiny due to its policies that continue to affect seamless delivery of healthcare services to patients despite making full payments of their contributions. One such pitfall is the delay in pre-authorization of a patient's discharge after an admission, where SHA is required to approve or reject a patient's medical bill within 72 hours. An example is the case of over 100 children who remain admitted at Nakuru Level 5 hospital after undergoing surgery, but SHA has yet to authorize payment for their discharge several days later, despite them being medically fit to be released. Ken Gashui begins our bulletin tonight.
Challenges facing the Social Health Authority SHA have once again become apparent, this time at the Nakuru County Hospital, where over 100 children remain admitted despite being medically fit to be discharged. The hospital's medical superintendent, Dr. James Wawero, said that the facility organized a 5-day pediatric surgical camp in collaboration with doctors from different parts of the country, benefiting over 130 children, mainly for undescended testes and hernia. 1 month ago, Health Cabinet Secretary Aden Duale had this to say about admissions.
You can't have 3-4 people sharing one bed and you charge SHA for the 4 beds. The dignity of that patient is important to me, and that's why I said we will restore dignity in our healthcare system.
Nakuru Level 5 Hospital, which had good intentions to have the surgeries done earlier, now finding itself in contravention of the ministry's directive in its pediatric ward, which is now crowded due to delayed discharge, with some of the children now being admitted in alternative spaces. But who is to blame? The hospital has been ready to release the children, but first, SHA has to authorize their discharge from the facility. The Social Health Authority regulations of 2024 stipulate that Claims Management Office must respond to pre-authorization requests within 72 hours. But this appears to be only on paper. With these children who would have been discharged a day after the surgeries as an example, patients countrywide have to wait for the 72 hours period to lapse or even longer, leaving them held up in the wards even when doctors give them a clean bill of health to proceed with recovery at their homes. Alternatively, a patient who would rather not wait for the period to lapse would have to pay out of pocket despite their SHA contributions being up to date. The pre-authorization policy now emerging as one of the biggest headaches for patients, not only prior to admission but also during the discharge process. Ken Gashui, KTN.